Hi guys, welcome back to Meds Made Easy. My name is Tarun Verma. Today we're going to talk about Risperidone, also known as Risperdal, used a lot in children. It is used for bipolar, schizophrenia, and irritability related to autism. So that's why you see this dispensed a lot by psychiatrists and things like that. Let's see here, you can take it with or without food. Dosages, I'm not going to go over dosages depending on the diagnosis you have. The dosages can range from all different types and to several times a day. It is a, let's see if I can do this right. Benzoisoxazole antipsychotic. That means nothing to you, and it should be nothing to you. Let me try to explain this the best way I can. It is very complicated how it really works. It affects your alpha receptors, your dopamine receptors, and your serotonin receptors. And that's just the easy stuff about it. I'm talking about different types. So of all your serotonin receptors, you have a bunch of different ones. So this one works on certain types, but not these types of serotonin receptors. Same with dopamine. It'll work on some dopamine receptors, but not all. Same with alpha ones. And then if you want to get really nitpicky about it, the receptors it hits causes and elicits a different response. So again, for these types of videos, I don't want to go into that. It just gets too complicated. But essentially what it's doing is it's altering your brain chemicals, right? That's just the easy way to put it. And it's doing it in a way where people that are generally known as psychotic, in terms of pharmacy terms, not movie terms, right? Movie psychotic is something else, but in terms of the medical world, psychotic means you're a little too excited. You're a little too, we need to kind of bring you down a little bit, right? It's the opposite of depression. Depressed people are just, we don't have any energy, your mood is always down, you're fatigued. Psychotic means you're the other way around. You're just always, you're just overly excited, and what we need to do is we need to calm you down, but yet keep you happy. We don't want to, because usually, and also in medical terms, is whenever we calm you down, we're generally bringing everything down, your energy, your mood, everything, right? So kind of like nausea medication, that's a really good example. When you go on a plane or you get on a cruise or something and you take one of those, it lowers everything. It makes you sleepy, it makes you tired, it kind of turns you off, like in terms of like your brain. You should not be trying to study on Dramamine or anything, but this medication, we want to bring you down, we want to calm you down without the mood element of it. We want to still keep you happy, but we want to bring your energy down a bit, and so that's how this kind of works in that respect. Let's see here, if you have liver issues or renal issues or even heart issues, because there's a QT prolongation thing in there. Again, I'm not going to go into that, but point is, if you have any sort of heart conditions, or if you're on a lot of medications that go through your liver or kidneys, you need to make sure your doctor knows. It's very, very important. Beyond that, there is a black box warning for increased mortality in elderly with dementia-related psychosis. Very, very complicated stuff. Essentially, if you're over 65 and you have a history of dementia, then make sure that your doctor's carefully monitoring you while on this medication, because it can cause an increased mortality, so a higher risk of death due to it. But if you're young, you don't need to worry about that. So beyond that, for pregnancy, it is a pregnancy class C, which means the benefits have to outweigh the risks of this medication. Okay, so there have been studies done where it has shown harm to the fetus, and then other times it really hasn't. At the end of the day, the official tagline here is that your doctor needs to assess this, so it has to be done by a case-by-case basis. They're not saying outright, if you're on this medication, you know, if you're pregnant, you can't be on it, or you can be on it. It's just every case has to be specialized. So again, like I said, benefit versus the risk. It is excreted in breast milk, so there's this thing called RID, relative infant dose, meaning that in little amounts, it is safe for a little baby to be ingesting it through breast milk, but your doctor needs to be checking your levels from time to time to make sure that there's not too much that your baby's taking in, because too much of this drug, not good. Babies are developing. You don't want to put too much of this drug in their body. It'll affect the way that they grow. So that's why we have this thing called RID, relative infant dose. I think that's it. If you're ever planning to get off the medication, there needs to be a taper system. You can't just stop this right away, right? You have to take a little bit less each day and kind of wean off over the period of weeks. Depends how long you've been on it. The longer you've been on it, the longer it takes to wean off of it. Same thing for when you're first starting the medication. You need to give it a few weeks to really see the maximum impact of this medication. It's not going to just kick in a week and be good to go. No, it takes a little bit longer than that. Again, we're talking about readjusting your brain chemicals, so that takes a little bit of time, and especially for it to stick. So that's why it takes a little bit of time to see that effect. And so same thing for when you stop the medication, you're going to kind of see this prolonged effect. And so kind of takes a while to get on it and a while to get off. That's just kind of how these medications work. I think in a nutshell, that is it. I will put up a list of side effects right here. Generally, again, this medication really is good for children, for kids. Really, really well tolerated. They do really good on it. A lot of psychiatrists like this medication. And yeah, so beyond that, guys, there shouldn't be any issues there. If you have any questions, concerns, please give us a call or leave them down in the comments below. Give us a like on Facebook, and we'll see you next time on Meds Made Easy. Bye.